Wanting to be left out, residents of Dakibuyi community within the Federal Capital Territory are calling for an improvement in healthcare services within their communities. The residents made this demand during a medical outreach organized for them by a pressure group. TVC's Kemi Balogun reports.
This small community within the Federal Capital Territory is called Dakibuyi in Hausa, which means two rooms in English. Residents of this community are out and excited today because they are receiving guests who are giving them free medical healthcare services and treatment. Esther Edet is one of those who have ventured out today to attend this medical outreach to check her baby. She said she made a 2-kilometer walk to get here and says it was worth it.
I've been taught on how to feed the child properly and what to give the child and the vitamin that the child is needed to add weight because she's not gaining weight at 1 year.
Other beneficiaries expressed delight over this outreach and call for more healthcare interventions, especially from the government.
Many of my sisters, my brothers, we are sick, we are not feeling fine, as in to get the money to go to the hospital is not easy for us, and we benefit they are coming here and it helps a lot.
We have about 5,000 to 6,000 people in this community, but imagine we don't have even medical center in this community, upon the closer to the towns we are. So these things in fact have been bothering us a lot, and we've been reaching to the government that still up to now there's no any response. With what these people have done, in fact we are very, very much happy. Almost everybody in this community today is happy with them.
We only have one private hospital, and that hospital is quite expensive. It's not everybody that can afford it. So we hardly get any assistance when it comes to health situation in this our community.
Organizers of this event, who have constantly carried out medical outreaches like this one, say residents of this community were on dire need of a medical intervention.
Community is loaded, a lot of people, diverse human beings here, so we felt we should come here and see how best we can contribute to their health.
This is about the over 100 of this medical mission we're doing, and we do it across the country. And we always identify the communities where there is no government presence with regards to healthcare. Healthcare is very important.
These residents are just pleased that they can get free medical care without having to experience the exorbitant out-of-pocket expenses. Kemi Balogun, TVC News, Abuja.